May I now invite Minister Gan to begin with a few words. Minister, please.
Thank you. First, let me welcome you once again to our press conference. The vast majority of our daily cases continue to be migrant workers residing in the dormitories. As we systematically clear the workers and the dormitories, we expect the number to remain high over the coming weeks before gradually declining as we complete the clearance. My co-chair, Minister Lawrence Wong, will provide more details on our progress in clearing the dormitories shortly. Let me just talk about the community cases. Since the lifting of the circuit breaker some 1.5 months ago, the number of community cases has increased but continued to remain low, at about an average of 12 per day. In the past week, this is similar to the number in the first week of July. It will be useful for us to take a closer look at these community cases to better understand the underlying trends. Firstly, around half of the community cases over the last 2 weeks are linked, and most were detected as a result of contact tracing or proactive screening. We are always more concerned about the unlinked cases. About 7 in 10 of the unlinked cases were asymptomatic, and almost half are likely to be past infections as they are tested positive when we ran serology tests on them. They would probably not have been detected if not for our proactive screening approach, as they are asymptomatic. This means that they are unlikely to see a doctor because they are generally well, and they would not have been picked up otherwise. Therefore, the number of cases we see is actually somewhat dependent on our screening approach. Furthermore, amongst these unlinked community cases, we continue to see a large proportion linked to the construction and related sectors. They are classified as unlinked because we cannot identify the specific individual or cluster that passed the infection to them, but they appear to be linked broadly to the construction and related sectors. As I shared last week, we are keeping an especially close watch on the symptomatic unlinked cases that are detected in the community through our routine screening for acute respiratory infections, or ARIs. If these cases start rising, it could be an early signal to us that there may be an increase in the underlying transmission in the community. To detect these cases early, from 1st July, we have been testing all individuals aged 13 and above who are diagnosed with ARI symptoms at first presentation to a doctor. This allows us to detect infected individuals early and to quickly contain them and prevent further spread. We are now testing on average about 2,400 ARI cases a day. Even with this rigorous testing, the number of unlinked COVID-19 cases detected through this ARI screening in the community has remained stable and continues to be in the low single digits. This suggests that the prevalence in the community remains low. But this is not the time to celebrate and be complacent. We are certainly not out of the woods yet. Globally, there are now more than 13 million people reported COVID-19 cases and more than 500,000 deaths associated with COVID-19. Many countries, such as the United States and Brazil, are still reporting surges in case numbers with no signs of slowing down yet. The World Health Organization has recently warned that the situation would get worse unless there is collective effort to control the transmission of the virus. While some countries, including China and New Zealand, have largely managed to bring the outbreak under control, several others are experiencing a resurgence of cases a few weeks after lifting their strict social distancing measures. Some regions have had to reintroduce restrictions in an attempt to bring the transmission under control. Let me show you a chart just quickly. We must be prepared for a second wave too, but we must do our best to avoid it if we can. There are useful lessons we can glean from their experience to avoid a similar scenario in Singapore. The Ministry of Health has reviewed these case studies and found that in many countries or regions where there had been a resurgence of cases, it was because safe management and safe distancing measures had not been adhered to. As you can see from the chart, many countries are seeing a second wave confronting them. From these cases, we have found that some had gone out when they are unwell and mingled in settings where many people had congregated. These include religious events, parties, and large family gatherings. In South Korea, for example, door-to-door sales resulted in 4 clusters with over 200 infected cases. And religious gatherings there resulted in more than 110 confirmed cases recently. In Tokyo, Japan, more than 300 cases have been linked to nightlife establishments. In Victoria, Australia, large school clusters have been spawned as students did not practice social distancing and participated in non-school related social gatherings outside. In Hong Kong, there have been outbreaks at restaurants and cafes as patrons did not put on their masks after they have completed their meals. In many regions, lapses in workplace safe management measures, including workers not wearing masks, have resulted in large clusters too. I know many Singaporeans and organizations are keen for more flexibility and further relaxation. But from these examples, we know there are settings and activities that are more susceptible to transmission, where there is close and prolonged contact among individuals. These include workplaces, religious gatherings, as well as nightlife establishments. That is why in Singapore, we have taken a cautious approach in easing restrictions for some activities that we know to be of higher risk. For others that need to continue to function, like workplaces, we have put in place a series of measures to reduce the risk of spread at these settings. Some of these measures create inconvenience, but it is better to be safe. Still, with the significant expansion of economic activities and social interactions since phase 2 started, we should expect to see the number of cases rise. What is important is to detect these cases early and ring-fence them to prevent further transmissions and the formation of large clusters. The second wave is preventable if everyone plays our part. And I believe that if anyone can do it, Singaporeans can. Thank you. I'd now like to invite my Director of Medical Services, Professor Kenneth Mak, to give an update on the medical situation here.
Thank you very much, Minister. As of today, the 17th of July 2020, the Ministry of Health has preliminarily confirmed an additional 327 cases of COVID-19 infection in Singapore. As Minister has mentioned, the vast majority of these cases are work permit holders who reside in foreign worker dormitories. Based on our investigation so far, there are 9 cases in the community, of whom 6 are Singaporeans, all permanent residents, 3 are work pass holders. In addition, there were 3 imported cases who had been placed on stay-home notice upon arrival and who were tested positive while they were serving their stay-home notice. We are still working through the details of these cases, and further information will be provided through the press release that was issued, that will be issued later tonight. Minister has also mentioned about the presence of community cases that we have seen over the last few weeks. While we have identified about half of these cases to be close contacts of previous cases and had already been quarantined, we have also noticed that there were a number of transmissions occurring from the workplace, and clusters had arisen from some cases infected through the course of work and who had in turn infected household members. We continue to be aggressive about chasing these active clusters. We take aggressive public health measures to ring-fence and isolate all close contacts in order to disrupt any potential onward transmission. The number of community unlinked cases remains a focus of our attention, and many of the unlinked cases are identified, as Minister has mentioned, through routine, regular testing of frontline workers and those in the construction, marine, and process sectors. They are quickly identified and isolated. We perform close contact tracing of close contacts in order to quickly identify those that need to be quarantined. And a testament to the fact that we are able to throw a net quickly around these close contacts is evidenced by the fact that our interval between the date of onset of symptoms to isolation continues to decrease for all our community cases. And we are able, on average, to isolate community-linked cases within a day, if not 2 days. So that allows us to be effective while throwing a net wide. We had in the previous press conference also updated about our contact tracing and screening efforts based on a cluster of cases in a housing block in Tampines Street 11. 152 residents and 25 visitors had been contacted when we screened 57 households. 123 persons had taken up our offer to undergo PCR testing, and I was pleased to note that all had negative results. The residents and visitors remain under phone surveillance, and we want to confirm and ensure that they remain well. We continue to perform surveillance testing in the community, as the Minister has shared, and indeed, we have seen those numbers come down very steadily since we've moved into phase 2. In the preceding period between the 8th to 10th of July, for example, out of 4,191 samples collected from ARI cases, only 1 case was picked up, and that continues to confirm our belief that the incidence of community unlinked cases, cryptic infections, remains low. When we look at various indicators like the reproduction number to identify how cases are transmitting in the community, that has been consistently well below 0.5, which continues to be a testament to our aggressive attempts to isolate and ring fence. We note that the number of imported cases has risen in the last 2 weeks. The Minister has alluded to that. A number of the imported cases come from the Indian and South Asian subcontinent. Many were Singapore citizens or permanent residents returning to the country. These cases were all placed on SHN, isolated immediately on arrival, and tested while on SHN, and there has not been any risk to the community as yet. But because of the high incidence of cases in these various countries, we continue to watch the situation carefully and continue to be vigilant about the risk of transmission to the community from imported cases. Thank you.
Good evening. I'll give you an update on some of the work that's happening with regard to the clearance of workers and dormitories. We are in the final stretch of this clearance work. Thus far, we've used a combination of different techniques, including serology tests and PCR tests to clear the workers, and we've been making good progress. So in this final stretch, well, I should say that up to now, we have around 230,000 workers. 230,000 workers have either recovered or have been tested to be free from the virus. These are workers in the dormitories, be it purpose-built dormitories or factory-converted dormitories. Altogether, we're dealing with about 300 over 1,000. So we have made good progress in clearing 230,000 of them. The remaining workers that we are looking at, most of them have been, all of them have been isolated. In fact, they are mostly waiting for their final exit test, as it were, to be tested at the end of isolation, and then we decide whether they are negative, or if they are positive, we provide the necessary treatment for them. So in this final phase, many of the workers have come from dormitories with higher prevalence, and so in this final phase, as we clear through this last group of workers, we are finding more of them to be tested positive at the tail end or at the final test. And that's why you've seen some increase in the COVID cases from the dormitories in recent days, including today. We expect this trend to continue over the coming days, but the main point is we are completing the clearance of all the workers in the dormitories quite soon. We believe that by mid-August we can complete this work, possibly even earlier than that. So we are doing everything we can to complete that work and to allow the workers to resume work safely thereafter. So this is an important milestone, the fact that after the clusters in the dormitories flared up, we've had to manage, contain and control the flare-up in the clusters, but now we are reaching the final stretch and are able very soon to complete the clearance of all the workers, all the dormitories, and eventually have these workers back at work. The second front that we have to deal with, besides the dormitories, after we've done the work on the dormitories, the second front that we have to deal with and to be very vigilant on, besides dormitories and community, is imported cases, as we had to in the past. Because as you heard just now, the external environment remains one where the virus is spreading quickly, and even in countries that had controlled the virus successfully before, they are now seeing a resurgence of cases. So the cases from overseas coming in through our borders represent another risk for us, even as we clear the dormitory cases. And therefore, we are monitoring the situation very carefully. Our overall advisory remains for everyone in Singapore not to travel, to avoid all travel. That remains the overall posture for now. At the same time, we are assessing the situation in various countries. Earlier, a few weeks back, we had adjusted our border measures to allow travelers with recent travel history in certain areas where we assessed the virus to be under control. When these travelers enter Singapore, we allowed them to serve their 14-day isolation period at home in their place of residence, instead in place of a dedicated facility. In other words, they serve their stay-home notices at home instead of a hotel. That was a move we made earlier. But we have updated our assessments based on the latest situation. And given the resurgence of cases in various places, we have decided to change the advice or the requirements for travelers with recent travel history, including transit to Australia, the state of Victoria of Australia, Japan, and Hong Kong. Travelers with recent travel history or transit in these areas will now be required to serve their stay-home notices at dedicated facilities instead of their own place of residence. And this will apply to all travelers with recent travel history in these three areas entering Singapore after 19th of July 2359. So this is the change we are making. Again, it's, I think, not something new because, as we have repeatedly emphasized, our border measures are not static, they are not cast in stone, and we are constantly reviewing, updating them based on our assessment of the viral situation around the world in different countries. So this is one move that we are making now, and we may well make further moves as we assess the situation. The long and short of it is the fight against COVID-19 is not over. We've said that repeatedly. And again, it bears emphasis. This is a long fight for the world as it is for Singapore. And you can see around the world now, the number of cases globally continues to rise. It's not plateauing. It is rising. In some countries, you're seeing resurgence. In some countries, it has not even been controlled at all, and the cases are still accelerating. So we really need to remain vigilant both at our borders in terms of the measures we have in place at our borders, as well as within our community to continue to ensure that we control the infection and control the spread of the virus within our community. And we need everyone to cooperate and do their part in terms of individual actions and social responsibility too. And if we do all that, we have a good chance of continuing to keep COVID-19 under control while we progressively reopen our economy and our society. Thank you.